that I notify the public that this meeting is recorded. Therefore, please be aware that an audio and visual recording of this meeting is being made by Boston City TV, a part of the City of Boston Office of Cable Communications, and is being broadcast on Xfinity Channel 24, RCN Channel 13, and FiOS Channel 962. With that, I will hand it to our chair.
Thank you, Andrea. This is Wes Ireland. I'm the board chair, and I'm calling the meeting to order, please. I'm going to begin first. I think we should introduce ourselves, please. If I could have each board member introduce themselves and note your role and which area of Boston you currently live in. And I'll start with myself. Again, my name is Wesley Ireland. I am a man, and I'm using sign language through the entirety of this meeting, and I have two female interpreters, so you'll hear female voices when I'm saying something. I live in the North End, and I'm just trying to see who else is on my screen here, so I will call you in order of who I see. I'd like to call out Olivia. Olivia, why don't you go ahead and introduce yourself, please?
Sure, my name is Olivia Richard. I am a constituent of Brighton.
Thank you, Olivia. Next, could I have Jerry introduce themselves, please?
Sure. My name is Jerry Boyd, proud advisory board member, and I represent the neighborhood of West Roxbury.
Thank you, Jerry. Next, can I have Richard, please?
Hello, everybody. I'm Richard Gorofsky and a member of the board, and I am from Back Bay.
Okay, thank you. Next, can I have Charlie?
Hello, everyone. My name is Charlie Kim. I'm a resident of the North End, and I'm here representing parents with children with disabilities.
Thank you, Charlie. Now, Carl, you're next.
Yes, hi, this is Carl. I identify as a deaf-blind individual, and I live in Brighton Center.
Okay. I also see that Elizabeth is here. Elizabeth?
Yes, hello everyone. I'm Elizabeth Dean-Clower. I live in Dorchester, and I'm a board member.
Thank you. I'd like to recognize that there are now, we seem to have 7 people here, so that means we do have a quorum. I'd like to ask Commissioner Rakosh to please go ahead and introduce yourself.
Hi, everybody. I'm Krista McCosh, and I'm the Disability Commissioner in ADA Title II Coordinator for the City of Boston.
Thank you, Commissioner. So we're going to move ahead on our agenda for this evening. So our agenda for the month of September's meeting. I'd like to ask that we approve the minutes from the July meeting. So does anyone want to, does anyone have a comment? Or should a board member go ahead and maybe make a motion pertaining to the minutes from last meeting? Jerry?
This is Carl. I make a motion to approve.
All right. Thank you, Carl. And I see Jerry also has his hand raised, so I'm going to assume that that's a second.
Yes, I would, but Carol beat me to making the motion, but I'll gladly second the motion.
All right, great. So all in favor, please raise your hand or say aye.
Aye.
Okay, great. Are there any opposed? Seeing none? Great. Okay, any abstentions? All right, the meeting minutes from the July meeting have been approved as read. Now I'd like to go ahead and recognize another board member who's here. Are there any other board members here who have joined us? I think Paul. Could you introduce yourself and let us know what area of the city you live in, please?
Hello. Yes, this is Paul Karen. Sorry, I was on and then I had to go off. I had a call come in. I serve as the secretary of the board. I cover the West End Beacon Hill area for the disability, and I am a strong advocate for mental illness. Thank you.
All right, thank you. Thank you, Paul. Is there anyone else here who's with us either on the phone who would like to introduce themselves? A board member, that is? Okay, I'm seeing none. So I think we're going to go ahead with the next item on our agenda. I'd like to recognize Bill Henning from the Boston Center for Independent Living, Anti-Discrimination Work. I see Bill is here, so if you'd like to go ahead and share your information with us, please.
Sure. Thank you, Wesley. And you'd be better off if it was Mel King speaking instead of me, the late, great Mel King, on the slight slip by the interpreter there. But it's great to be here. I'm Bill Henning. I'm director of Boston Center for Independent Living. I know a lot of you. I know some of you, like Jerry, almost too well. Just kidding. Jerry's been a great board member with BCIL. I've known Olivia for years, and many of you, Kristen, and on it goes. As you may be able to hear, those who can hear, my apology, Wesley, I have a cold. I'm a little bit hoarse. It's hot in this office, and I don't want the AC blowing the dry air, so I'm a little more casual than I would be normally in a presentation in a t-shirt, but it's all gonna work for this presentation for me. I was asked to talk about healthcare accessibility. That was a subject I know that you discussed in a previous meeting. Lisa Iazzoni, one of our board members, spoke. Lisa is probably the national expert on access to healthcare for people with disabilities. She's not the BCIL expert, she's the country's expert, I think. So I'm glad she's not speaking tonight. I would have nothing to say if she was preceding me or following me, because she knows things inside and out and has been a tremendous advocate by means of outstanding academic research, publication of numerous articles and books. But what BCIL has tried to do, and we've worked with a number of you here on this, is promote accessibility in medical facilities locally, specifically in Boston. And actually more so as well with the state of Massachusetts. Talking about healthcare access, I think, is something really critical. I think it's something that a lot of people have a challenge talking about for themselves personally. Some people will speak up and be rather loud about it appropriately, raise the issues. But healthcare in this country anyway, and that's the only country I really know, is a very personal thing for all of us. So if you're talking about healthcare and barriers, you might be talking about intimate care. And most people don't want to broadcast that in a typical forum like an advocacy forum. Many of you may not want to talk about any specific barriers you've experienced today. You don't want your personal health out on TV. This is being televised. No one wants to talk about such things. It can be very intimate, the medical setting can be very intimate. I think we all know that. You go in for a checkup. I go in for a checkup. I'm able-bodied, but they say, you know, undress, put on this little Johnny that's about as flinty as any article of clothing ever created. You know, there's not a lot of privacy there. And then add to it the fact that most of us try to develop good relationships with our medical providers. And if we're denied access, we don't necessarily want to be complaining or raising issues with the person who's providing the care, who might be a lifeline for some of us, who might be providing very rare, significant care. I see my good friend Olivia nodding her head. The last thing you want to do is say, Dr. Smith, Dr. Jones, whatever, he doesn't listen to me, he doesn't provide access, because he may be the best surgeon in the world or be the only neurologist who knows your disability or health condition in the whole New England area. So we have had, as a community of advocates, challenges raising advocacy. You know, if there's an issue with the city streets not being accessible, as Kristen knows, people file access board complaints, people sue the city of Boston. City of Boston settles lawsuits. There's been, you know, even when we're getting along great with the city, people still sue the city, you know. It's the way it is. We advocate with the state around things. We want better rates for PCAs. But boy, when it's healthcare, it becomes much harder for the disability community, and it's very understandable. Gosh, some of the biggest barriers we've seen over the years are in women's health. Think about it, women's health, inaccessible mammography, inaccessible gynecological exam tables, things like that. It's taken special people to speak up, and I'm not decrying or putting down anybody who hasn't, because we respect that. But with all that said, we have been able to advance some changes. Probably, I think it was around 2008, 2009, excuse me, we were able to organize a number of people who received their services in what was then called the Partners Healthcare System. It's now Mass General Brigham, MGB, to speak up. And we threatened Partners with a lawsuit. And it was a major ADA lawsuit for failing to comply with accessibility requirements. We never did file the suit. We went into, from a legal term, what's called structured negotiations. And I might have to cough a minute, I'm sorry. And came to a binding legal agreement. And what this did was prescribed a whole bunch of improvements that Mass General, that Brigham and Women's, and that other hospitals in the system, such as Faulkner in Boston, would undertake. And I just want to add, I'm from Hyde Park. Everyone got to tell where they are from Boston. I'm a resident of Hyde Park, by the way, so very much part of the city. Again, excuse me. And what that did is it probably pumped in maybe $150, $200 million in access improvements to hospitals, the flagship hospitals especially. And, you know, accessible doors, bathrooms, automatic doors. Excuse me. I can keep going. I hope it's not too irritating. I apologize. Could we just wait a minute? I'm going to get some water.
Bill, if I could, if you need a break, that's totally fine.
Just give me a minute to get some water, I think.
Go right ahead and do that. That's totally fine. Okay, go ahead and do that.
Hi, it's Kristen.
Commissioner McCosh, I see your hand is raised. Yes, you have the floor.
Thank you, Wes. I was just going to add on to Bill's comments that I also worked with BCIL back in those years on some agreements with Boston Medical Center. I don't remember them being structured negotiations, but we definitely came to some agreements which improved accessibility and patient access at BMC. So it was a wide range of Boston area hospitals that did receive training and made some accessibility improvements several years ago, that many of which are still in place today.
Sorry about that. Thank you for letting me get a break and cough a little bit off camera. So anyway, the other thing we did besides the access improvements, and I think this is real important for everyone to understand, we didn't just go in and say, oh, we want wider bathroom doors, which is important. Or better disability parking, all very important. We said you have to look at your policies and practices as well and be sure that they comply with the ADA. So that means lots of things. It means looking at scheduling too, scheduling appointments. One of the things that hospitals are classic at doing is giving you bang bang appointments, or appointments whenever it works for them early in the morning, or appointment here, an appointment on the other side of the campus. Those things don't necessarily work for people with disabilities, younger folks, older folks, who may have a mobility challenge, may have a sight challenge, may not be able to follow the paths in the hospital for cognitive reasons, you name it. And what we started to do is get better scheduling, for instance. And you start to try to change your culture, and a lot of it was around communication. It's communication access, ensuring or raising the bar on providing interpreters, ASL interpreters, but it's also trying to get people to listen to, as you're called in a hospital, a patient. I don't like the term when referencing people with disabilities because it harkens back to that old medical model where folks with disabilities are kind of a specimen, and it's very disempowering, but that's the reality. When you're in a medical facility, you're typically a patient unless you're visiting. And, you try and change the culture. I think Zari, who's on the commission, could talk a lot about this. She works and is the disability program at Mass General, and that was a position that came out of the agreement we reached with partners. And they were in effect for about 6 years, so they lasted through 2014, 2015. As I heard Kristen saying, as I came back into the meeting, we also took this concern to Boston Medical Center and raised the issues and received a very positive reception there as well. And I will say it was tense for a while with the Mass General and Brigham folks, but the presidents of those institutions at that time came to BCIL. They heard from people who had faced barriers. Pam Daly was one of them, great member of BCIL, active in Boston. I think she lives in maybe Charlestown or the North End. Other people, late Stacy Burloff and a few others. They were just great. And then we went down to BMC. Sergio Gonçalves, the late former chair of BCIL, was one of the leaders. And they did the same thing at BMC. We even made some great videos for training, and our members really highlighted, Sergio Barbara Rivero, who lives in South Boston, highlighted the importance of communicating with people with disabilities. And those were big changes. I think what's important is that in order to sustain this, we have to keep at it because staff change, priorities change. There is, very importantly in this state, an effort to highlight healthcare equity. Today, BCIL was at a hearing at the State House on establishing healthcare equity within, legislation that would require more reporting of data based on race, disability, ethnicity to track underserved, disenfranchised populations, how they get their health care. And I think we as a community need to keep raising these issues. These were some of the big things that BCIL did, but we have continued to raise the issue at the broader state level and a bit nationally. We did get really good news probably 10 days ago now. U.S. Secretary of Health and Human Services announced new proposed regulations that would increase accessibility of diagnostic medical equipment among a number of sweeping proposals. No coincidence, on the committee that helped design these proposed standards was Lisa Iazzoni, serving as a representative of BCIL. So we're very proud of that, and we hope those get approved. But what we've asked the state Medicaid office to do, Mass Health, and this is about 10 years ago now, was to look at all of the programs for which they provide funding, which is just about every medical facility in the state, every doctor's office, community health center, hospital, and check them out for access. And we were prepared to sue them. And this was right after Charlie Baker became governor, so it was about 2015. And we didn't. We agreed to talk it through with them, and many of us think this was probably a mistake. Why was it a mistake? A lot of good people at the start of the administration, very interested in working with us, but over time, priorities shifted. Notably, of course, the pandemic came around. That's where all the attention had to go, and this good effort to start incentivizing medical providers to increase their access kind of got pushed aside. You couldn't say anything. I mean, we were all focused on just trying to get through the pandemic. BCIL worked closely with the commission, acquiring masks when no one had masks, getting tests from the Public Health Commission out to members. That was the priority. But, if we had had a lawsuit, some things might have still been in place. It requires the accountability, but sometimes you make a mistake in your advocacy decisions. And the fact was we had good supporting cast in the administration, just some of them moved on, and again, the pandemic intervened. But what we're trying to do is get the state to really start requiring the providers to do access surveys, and we're starting small, focusing on diagnostic medical equipment. We still believe people may not be weighed. Heard somebody say that today up at the State House, that they, if you're not weighed when you go to the doctor's office, well, one, that's a classic marker of wellness and health, and two, if you're being prescribed meds, well, some number of meds are based on, the dose is based on your weight. Is the table accessible? Does it adjust to the person? A full medical exam for somebody who can get on an exam table is done on an exam table for a reason. It allows the exam to be run in the best way. Same for equipment such as x-rays, I mentioned already, mammography, MRIs, CAT scans. I'm no doctor, no medical expert, but I think all of us have interactions with the healthcare system. And are there people when you need them? Will you get the interpreters too? Very, very important. I think it's understood for people for whom English isn't a second language. I worry that, ASL doesn't always get treated that way. Years ago when I was working on Cape Cod, I'm going to just tell this story because I like to tell stories, and I've got a bevy of them because I've been around a long time. But there were a group of deaf advocates in Cape Cod, and we were working with them. I was with Cape Organization for Rights of the Disabled at the time. We couldn't get interpreters at Falmouth Hospital. And there was a large deaf community in Falmouth. There was a program down there for deaf people. And we decided, well, the story was like, the janitor's brother is deaf, so he knows some sign, which of course is woefully frightening as a response. So we went in and asked for a meeting with the hospital president. Small town, we got a meeting with the president. And we just had 10 deaf people walk into the office and start signing and talking to him. And really laid home the point of, this is what it's like. You don't know what's going on. Translate that into getting critical, intimate medical care. We need full access. And I think what the message is from that story and what, you know, what we've done with, or did with Boston Medical Center, with Mass General, with Brigham, and again, it extended out to the Faulkner and other facilities owned by MGB, was that people spoke up. And again, it is a very challenging thing to do for the reasons I said. I've heard it from people again and again. We totally get it. But what we're looking to do is to go back to Mass Health. And we've had some hard time finding folks to speak up and start saying, you've got to do that. You know, nothing's more humbling sometimes. You know, I've been around a while, as I said, and you think you know what you're doing sometimes with advocacy. But, you know, I've been doing this for a long time, and we work closely with Linda Landry, who's on the BCIL board and been an attorney with the Disability Law Center for 30 years, a great attorney. And we had Dan Manning, who was with Greater Boston Legal Services for 50 years, mastermind of a lot of lawsuits to help people with disabilities. We would talk to Mass Health and, you know, 3 hotshots, right? We got nowhere. We were at a dead end because we had lost the members, the legitimacy of the voice of the community. I don't know if it was humbling. I was thrilled by it because it proved what we try to do at BCIL, which is give voice to people with disabilities on these issues. And I think that's what's really needed to advance healthcare. You know, I can talk about lawsuits or legal agreements or things like that, but make no mistake, they were driven by the personal stories and the personal power conveyed by the people who were denied equitable healthcare. We weren't using equitable as a term, but that is a current term, and it's a valid term, and it's a wise term. And I think that's where we are right now in the state, in the city. Obviously, this is the mecca of healthcare for New England, not to put any other medical institution down, but what happens in this city tends to drive what happens in New England, sometimes the country, as we know. So there remains lots of things to do. And because it's so personal, because these things happen, the barriers, what frankly is discrimination, cut and dried. You know, we're 33 years beyond the signing of the ADA. It's discrimination. It's, you know, there's no sugarcoating of this. It will still go on. You could say it's ignorance, you can say it's awareness, but it's discrimination. It violates the law, and enough is enough. So we look to go back to Mass Health, and try and raise these issues, but we're not going to do it until we get some more folks who can speak up and give power to it. All my talking's not going to do a blessed thing. That was proven. But when we can align with community members, we can go somewhere on these issues. And again, these issues affect all people with disabilities, people with intellectual disabilities, people with physical disabilities, mental health conditions, you name it. So that's the couple times up and down the elevator on healthcare access from BCIL, but I'm happy to discuss it further, answer any questions. I got to jump onto a meeting at 6:30. Maybe you want to move on soon or whatever, but I really appreciate the opportunity to talk about this in the interest. Should I just call on people as I see hands?
Yeah,
Wesley?
this is Wes. I want to recognize that there are some board members here who might actually have some questions. And so I guess what we'll do is we'll open this up for discussion. So we'll give people a few minutes. And then thank you very much, Bill, for sharing the history of the relationship with how we've advocated with local hospitals. I'd like to recognize Charlie. Charlie has a question for you, and we'll give the floor to Charlie.
Sure.
Thank you, Mr. Henning, for coming and actually discussing this and kind of giving the history and all the work that you've done historically. It was about maybe within this month, there was a McKinsey report that came out about equitable access and the disparity with, they did a global study, and then it kind of talked about in the roadmaps and the steps to reduce that gap of healthcare equity. Specifically, it was called was the article? The article is called The Missing Billion. So I was looking at the global number of individuals. And like you stated, it talked about advocacy is very important, both on collecting of information and storytelling. But then I think you just touched on this, and I'm trying to figure out what we can do to help, because I think you had stated the words advocacy and then legislation. The McKinsey report specifically came out and talked about the lack of data, right? and the lack of collection of data. And you had mentioned that now they're doing surveys to collect information on race, on disability, and all that. Quick question: is that a requirement by law, and are you pushing for legislation to do that, or is this sort of a voluntary thing that hospitals are doing? Because I think part of accountability is to be able to have access to very clean and good information and data in order to work towards that accountability and opening up the equitable access.
That's a great question. What we were asking Mass Health, and I said it's been stalled for about 2 years now, a year and a half maybe, was to ask medical providers to report on accessibility broadly. Mass Health would go out and ask providers, hospitals specifically, questions on, is your radiology accessible, or is this accessible? But they would just check one area. They weren't doing the whole 360 degrees, of a facility. Obviously, there's more and more data collection in healthcare. Healthcare providers will say we have to report too many things. I'm entering data in medical records instead of looking my patients in the eyes because I'm typing into a system. But that said, we don't know outcomes. We understand there are problems for underserved communities, but we don't know the depth till somebody zeroes in. And then we'll read in the Globe now or see it on TV, McKinsey may come out with a report that people of X and X background, let's say African Americans, will have a higher rate of heart disease or diabetes or asthma. Those things have been documented. We might know that intuitively from living in the city, but once you get the data, it can start to shape public health programs. It can shape initiatives on where to go. There was concern about high death rate in COVID among people of color. There was a great focus on the city of Chelsea with lots of immigrants. So that's where the data comes in. The legislation being heard today at a hearing, and it hasn't passed, was advanced by the Equity Compact, which would require data collection on numbers of categories. I think they would probably establish a board to consider what those are for all various races and ethnicities. And added to that was the request that it include people with disabilities. So we understand things. I think oftentimes, it's been my experience, people with disabilities may not live as long, and people just say, oh, they're disabled. You can almost see it's dismissed. Well, what would you expect? But there may be underlying reasons for that, inadequate care, deficiencies in care. So that's why it's important. So I think the data collection really can start to identify issues, which is critical to identify solutions.
Okay, I'd like to recognize 2 more board members who have something to say. So first, let me recognize Richard. And
Thanks,
then
Wes.
Elizabeth.
Thanks, Wes. Bill, first of all, thank you. What you do is so important, and I'm sure everybody on this call is grateful for everything you do.
I don't do anything unless we have people like you guys working. I'm just a talking head unless there's people who are real. But so thanks to all you guys, really.
Well, a question that's somewhat aligned with Charlie's question. And back to these surveys, as I recall from Lisa's presentation, she talked about her study, which is more a national study and not really a local one.
Yeah.
And I'm wondering, is this to sort of fill that in other words, to ascertain where the needs are? You mentioned in your presentation inaccessible tables, for example. And I remember that was a piece of Lisa's presentation. And I think there may have been comments too from commissioners and others about how some of them literally had appointments and they couldn't be fully examined because the table was not accessible. So is that what's going on with this idea about the access surveys? And are they to get that detailed in particular? And do they relate to private practitioners as well as institutions like some of the hospitals you mentioned?
Yeah, that's what we would like Mass Health to require everyone who's a recipient of Mass Health funding to do, to get a bit into, it sounds like it's the weeds, but it's not, because we understand the margin of error around people with disabilities is very, very thin. What's it matter if you can't get on the table? Well, it may be that you don't get a full skin exam and you don't detect the skin cancer. How's that? Or you don't detect the developing decubitus, skin breakdown. All kinds of things. So those are the reasons, you focus on diagnostic medical equipment. Part of a strategy there too, as well, is just if you can focus on this area, it starts to incorporate the concept of accessibility and looking out for these things into the practitioners. You could have a survey and they could have all the equipment right, but if no one knows how to use it, then it's, if they don't know how to adjust the exam table for the people who can't hop up onto it, or whom say they're short stature, say they're little people and they can't get up there, they don't get the exam. Or they have something like, well, let me just lift you, which the indignity of lifting an adult like that is off the charts. So, and what also happens, and this is the real important thing that sometimes gets overlooked, when people encounter the barrier, and it may be humiliation. It can really be humiliation. They don't go get the medical exam. And you'll find people, I haven't had a GYN exam in 10 years because it was such a nightmare, I think we're better now. I think we've developed awareness more broadly in the community, but that's the thing that's hard to measure. So maybe, if you collect data, you start collecting how many people with disabilities actually get this kind of exam versus that kind of exam. How many with disabilities are actually getting vaccines versus not getting vaccines during a pandemic. I'm not the data expert on how to set up systems to collect it or anything like that. I'm more kind of the political advocacy guy who will focus on the human story, but the human story, I think, moves systems to act. I think then when they act, you want it to be effective within it. And I think that's where the data comes from, so that good people know what to do and where to go and make the changes. But I wouldn't want to get totally caught up in the data, because some of this stuff we know and we have to speak it up loud. It's kind of a little bit of each. But we would love to see Mass Health reinvigorate this. Right now it's a choice, and it's, these systems are just extraordinarily taxed. They have many things going on. They're not going to elect to do it, not because they don't want to, it's because they've got so many pressures. So we've got to be a squeaky wheel is what it really comes down to. I don't decry any of the systems. I don't think they want to do anything wrong. They're in the business of helping people. But if they got all the pressures, if we're not on that list, we're left out.
This is Wes. Thanks for that. I would like to recognize Elizabeth. She has had her hand up for a while. Follow-up question, Elizabeth, whatever your comment is, go ahead.
Yes, please. Thanks, Bill. Thanks for presenting the history as well as the advocacy by BCIL in so many ways that this touches upon, health issues touch upon the lives of people with disabilities. In addition to the importance of continuing to gather the data, or the interest in our commission of trying to get an update on what's going on, not just both at the major hospitals as well as in smaller practices in the Metro Boston area. I think one of the issues you brought up as a barrier, and certainly is one, is this situation. I know doctors don't like the fact that they're often in this revolving door situation, going from room to room, of that appointments are only 20 minutes long. And so as a practical short-term solution in trying to get the word out on some changes that could be made, if it's not, I knew one doctor who would try to double book appointments when she could, that something was a quote extended visit, was a 40-minute visit. Again, not all, in all practices, this is someone who had been in practice for a long time, had a subset of people with disabilities. Some of her patients had complex medical problems that just couldn't be addressed in a 20-minute visit. So that's one way she handled it. Another way is that sometimes if they could be scheduled, you know, like if something is going into a lunch hour and isn't something that requires staff assistance of people who are going to be at lunch. There are some ways, I think that certainly on the part of people with disabilities of various kinds who need medical help, and often whom also need the transportation assistance to get to such appointments, they're very motivated to make it work on their side. And it's very frustrating to arrive at an appointment and be told, oh, the only way we could examine you is if it was in the procedure room, and that's booked today for someone else. Or yes, one exam table does lower, but you know, it's already in use. Whether it's in use by someone who even needs it, you know, remains often perhaps, you know, just it was first come, first serve, rather than that it was separated out. So I think what we're hoping, both in working with BCIL and others, is making inroads both in educating physicians and their staffs about, you know, what is necessary in 2023, as well as what's available, and as well as finding some pragmatic approaches, because certainly people who have disabilities need healthcare across the spectrum of specialties, but it seems particularly egregious when it's, say, a neurology practice or orthopedics, or certain ones where it's built into the discipline that you're going to have people who have either mobility issues, even if they're whether they're short-term, longer-term, as well as the many other reasons that having an adjustable table helps people. But I guess, especially seeing that Zari's not able to be with us tonight, what ways do you see that we could be working together to help both educate now or help with some short-term pragmatic solutions, as well as these, certainly the mass health angle is a very important one.
Thanks, Elizabeth. I think there's a couple ways to assist. One is, you know, when we're done, people can, I know a few of you have somebody can put my contact information in the chat, my email. I know more than a few of you have it, because I happily communicate with a lot of you. So that I won't do it. Andrea can do it. She's not. And And we're looking for people to pull together to just talk about some of these things and share some experiences with Mass Health. They don't have to be intimate, they can be veiled, but just to give that true voice to it. As far as educating people, there's a growing effort to educate practitioners. I think some of the teaching hospitals have reached out to us. So, you know, we've had people, our members, I've done it, but I don't think I'm nearly as effective as the individuals themselves, talk about working with people with disabilities. A lot of it comes down to communication, asking people what they need, trying to understand. I think you touched on a real important point. An exam may take longer for a variety of reasons, complex medical conditions, challenges in communicating, you name it. And these things affect the broader population too, make no mistake. They affect seniors at high levels who probably don't get the care. And it's kind of the system. No one's at fault, but we're all kind of living in the system. Some people know Linda Long out of UMass in Shrewsbury, used to be chair of BCIL in the 80s, I think, or 90s. Has done a tremendous amount of medical education with local teaching hospitals. And I think it's multifaceted. And one thing I've said as an advocate all these years, sometimes, you know, I work for an organization, I can talk about the systemic advocacy we do along with the services we provide, and we do a lot, you know, and I just want to give a shout out to Jerry for just showing up about 20 times in the last year on the PCA wage issue, and it's effective. You know, Jerry was a star, but sometimes it's what you do in your own individual lives, and sometimes it's, you know, we're at our office, we have an office on Dorchester Ave and Fields Corner, and we have one at Downtown Crossing, and I'm at Downtown Crossing now, and when I look out and see somebody get on a Silver Line bus with some kind of disability, I go, man, they're just making a statement. They're kind of changing the world still all these years later, you know? It's what you do in your own life sometimes probably does more than anything. And, you know, some people, younger folks say, what do you think the ADA did? And it, you know, established civil rights. It gave advocates a whole set of rules and regulations and laws. But most of all, it said it's okay to be disabled in America. And people started to go out into the community and say, I have a disability. You know, July was Disability Pride Month. It's kind of developing that identity that disability is regular, normal, so to speak. It's not abnormal. And I think that's one of the things to do. But it's hard in healthcare, as I've discussed, for all the reasons. But
Ms. West, Bill, thank you so much. I know that you have to leave at 6:30, so I want to respect your time. I just had one question that maybe I might be able to expect a short answer from you.
that's rare, Wes.
Fair enough. Fair enough. I understand. But I understand that today there was the hearing at the State House that you mentioned about the bill on preventing discrimination against people with disabilities for prevention and health care. So suppose the bill passes and the changes happen. Do you foresee any potential issues there in implementation? How?
Always.
What are the possible barriers there?
There's always devil in the details if this passes. And again, it was primarily to start tracking healthcare outcomes for people of color who have been tremendously underserved by the healthcare systems, and advocates in the Disability Policy Consortium got added disability, just to set that straight, but that's very important. You know, the challenge will be, it will take 5 years to set up the data to be collected in the systems, and will they do it, and will it be funded, and will the Department of Public Health effectively take the data? Will the Health Policy Commission for the state of Massachusetts look at it? And suggest initiatives we have to undertake. That's a pretty negative spin. Some of that will happen. What it will require is the advocates who push for the legislation to stay on top of it. I think one of the hardest things for advocates is we get all excited in a campaign, we push for a couple of years for, say, a bill or a new policy, then we walk away and think it's done. And actually the real hard work begins, because then the kind of, the Klieg lights are gone, there's no more headlines, it's just this mundane slog through who's doing this, are they going to enforce it, we've got this law, is anyone enforcing it? I always analogize the speed limit. There's a sign out on the highway and it says don't speed limit 65, but we darn well know that if there isn't highway patrol along that highway, everyone's going 75. Maybe 75 is okay, but we also know 75 is not the low speed anymore. People are going 85 and 95. So it's not enforced and we've got a danger. And in this case, anything that passes, it's up to us to keep it going. It's just the way it is. It's tough sometimes, but the ADA lives because people go out in the community and demand it does. There's some neat systemic lawsuits or rallies, the city got sued on sidewalks, but it's mostly people showing up and just saying, I want to be part of the community and I demand equity. And one of the last places where this is a big challenge for all the reasons I said is healthcare. It's a system that's grows, it's been kind of entrenched. And as I said, I didn't give you a short answer. But I think you guys are great. I've been very impressed for a decade, with the commission when the commissioner came on board under the late Mayor Menino, and keep it going under Michelle Wu.
All right, great. Thank you very much, Bill. Now, I'd like to just double check on the board to see if there are any other questions or comments related to Bill's presentation before Bill needs to leave us.
All right, well, thank you, everybody. Hope to see you soon. And Andrew, if you want to put my contact info in, if anyone wants to get involved, Linda Landry of BLC would be elated, as would I. But thank you very much. Have a good night.
Thank you so much, Bill.
Thank you, Bill.
Bye. All right, this is Wes, and I think the next item on the agenda, let me just pull that up to remind myself. All right, I found my note. Okay, now it's time for the chair's report. So let me begin. I've got 3 brief things that I'd like to touch on in my report. First of all, I want to say it's kind of hard to believe that summer is almost over, and we are only 3 days away from the official first day of fall, autumn. So yeah, I just want to let you all know that that's coming. Secondly, this is related to, it's a follow-up related to the Bill's presentation that he gave us again on the anti-discrimination work that's happening in healthcare. You all know that there was a hearing today at the State House pertaining to that bill. And I wanted to let you all know that there was testimony. I did submit a testimony and a letter as a chair of the commission here. And I actually, in my testimony letter, I wanted to show my strong support to the state bill, and I'm hoping that this will pass quickly. So we'll see. We'll see what happens next. Now, thirdly, I wanted to follow up on our July meeting when we talked about the possibility of writing a letter in advocacy for the bill, the House bill pertaining to the act relative to the end of life options. Right? And I know that John Kelly had expressed some concern about the bill back in July. Now, we, at that July meeting, the board didn't have a majority vote. So, therefore, what that means is a letter against the bill couldn't actually be written. Some members of the board have expressed the possibility of getting another point of view on this issue, perhaps from the opposing view to John Kelly's view. And I realize that it's important to have a balanced, a balanced information from both sides. So with that said, I'd like to find a way, see if we could have someone who might want to share a perspective to the advisory board on this other position. And so I'm kindly asking that we put this topic on hold for the time being until we find that person who can speak to this. At the same time, I think there's some concern because there hasn't been any movement on this state bill thus far. So that's what I have for my chair's report. Are there any questions or comments on what the points I've made? I see Charlie has his hand raised. Charlie, you have the floor.
Thank you. I think it's just more of an administrative procedural question. Does this continue to sit on old business, or where does this stand? I know that it's a request for a letter and everything, but we took a vote, but the reason why I'm asking procedurally, in order to keep this going in old business rather than continue just to roll it, because I'm sure people have opinions on it, so they would like to see us as a board not just move things around. Are we supposed to be voting to continue or to belay? I just want to make sure that we're doing something formal that just shows that this board does take action on things rather than just taking certain things that we work on and other things we just kind of just roll.
Yeah, thank you very much, Charlie, for that follow-up and that question. There was a decision in the executive committee meeting that was recently held to not include this in old business for the purpose of discussion, because we're thinking that it would be best for the board to have some other perspective, some other view on the issue. And that's why they asked that I include it in the chair's report, that we're seeking alternate view. Richard, I see your hand is raised.
Yeah, thanks, Wes. Apologies if I've forgotten, but was a copy of the bill circulated to us?
Andrea?
I'm sorry, this is Andrea. Richard, did you say a copy of the bill or a copy of a letter?
The bill.
I would have to check. I don't think so, because what was on the agenda for July was whether the question of whether the board wanted to even talk about a letter or not. And so what was attached was the most recent letter that the board had written, which would have old bill numbers. But I can certainly find the latest bill numbers and put them in the chat tonight.
I would think it would be helpful to have the bill before we decide on the letter. So.
This is Wes. Sure, I'd also like to add that we attach the letter, and what I'll do is I think we should just hold on this until we find someone who can give us some sort of opposing view to what we had heard previously, so we have some balanced information to share with the members of the board. Okay, and we can include the bill with that. All right. Any other questions or comments pertaining to the chair's report? Okay, seeing none, I'd like to now turn the floor over to Commissioner McCosh for the commissioner's report, please.
Thanks, Wes. And just to let the board know, I do have some colleagues who are involved in a group with the opposing view on assisted suicide. So I can share those resources with you, Wes, if you want to think about inviting them to a meeting. Okay, so I do have a report that Andrea is going to share. Great, thank you. Okay, so first up tonight,
Yes,
I would like...
Actually, Commissioner, sorry, this is Wes. Yes, please do share that information about the opposing view in the group names.
I will. Okay, great. So first on my report are just some general City of Boston updates. As you all know, Boston's been doing open streets for the past few years. And this year they made the open streets on Newbury Street a permanent condition for from July through October. So it's every Sunday from 10 a.m. to 8 p.m. on Newbury Street. The street is closed down for car traffic. And that is wrapping up soon. So if you haven't had a chance to try it yet, you have another week or two to try it, and then it will be over for 2023. And we also have one more neighborhood event this year, which is in East Boston. It's going to be Sunday, October 15th from 10 to 3:30. So like I said, it's a great way to experience the city with no car traffic. And they're great events. If anyone's interested, please plan to attend. Another update actually in City Hall is that the First Floor Coffee Shop entered into a license agreement with a new vendor through the Mass Commission for the Blind in the Randolph-Shepard Act, and they will be running the First Floor Cafe for the foreseeable future. So that's exciting. If you're in City Hall, drop in and pay them a visit. Some updates from my department. First of all, we've scheduled our Civic Engagement Day event. It's going to be on Tuesday, October 17th from 10 a.m. to 12 noon. This is going to be an in-person event in City Hall. It's going to happen on the 5th floor, which is the seat of our local government. The 5th floor has the mayor's office, the city council chamber, and all the councilor offices. So what this event is it invites people with disabilities to come into City Hall and see what the accessibility is like, get to see the city council chamber, get a chance to meet staff who work on civic engagement, Office of Neighborhood Service Liaisons, city council staff, the city clerk, and people will get to learn how to testify at a hearing or register to vote and try out a mock voting booth and learn about the Automark machine. So it's a great event for the community to learn how to exercise their civil rights. As Bill was saying, civil rights can, as we know, they can all be lessened if we're not actively promoting them. So we encourage everybody to attend if you're free and spread the word to your networks. We'll have an updated flyer out very soon. Another event we're having this month, next month in October. October is National Disability Employment Awareness Month. So every year during NDEAM, we do an event to promote employment of people with disabilities. So we'll be having a webinar called Pathways to Employment in the City of Boston. This webinar will bring together human resources staff from the 6 different agencies that post jobs for the City of Boston. If you want to work for the city and say you want to work for the Boston Public School Department, that has a different website and link to apply for jobs than a job with the Boston Public Library, for example. So it can be very confusing, and we aim to demystify the process and help people with disabilities get on a pathway to getting a job with the city. So that will be a webinar on November 14th, and we'll have information coming out about that very soon. One thing that's a little bit new this year is National Disability Employment Awareness Month is a national initiative, and they do promotional materials to talk about the accomplishments of people with disabilities in employment and also to promote employment among people with disabilities. So in their promotional materials this year, we have an opportunity to put our own pictures on the flyers and posters. So if anyone on the board is interested in being showcased on an NDEAM poster or flyer, please send an email to disability@boston.gov and let us know. And we can go to the next page. So I mentioned that we were going to get some transportation updates probably quarterly from BPS about special ed transportation. So we did speak with Dan recently, and he gave us these updates. So as we mentioned before, the responsibility of bus drivers falls to TransDev, the company that the city has outsourced drivers to. So TransDev currently has 743 active bus drivers and an additional 25 drivers in training. They were expected to be fully staffed for the start of the school year, which would have required 734 drivers for 632 routes. So we have a lot of drivers and a lot of routes to cover, but they were expecting to be fully staffed. In comparison, when last school year began, they only had 665 active drivers. So that's a big increase from last year, and it was on track to be fully staffed up. All data on BPS bus drivers staffing is tracked and reported by TransDev, so the city is not involved in those data reports. However, bus monitors, as we've told you before, are the responsibility of the Boston Public School System. So BPS currently has 601 active monitors, and they've recruited approximately 100. They had recruited approximately 100 monitors over the summer. We're working with their Human Resources Office to prioritize the hiring and onboarding of the monitors before school starts. BPS was doing that. In comparison, BPS began last school year with 497 active monitors. So again, a big increase from 497 to 601. They're focusing intently on recruiting, hiring, and training to meet the needs of all students who have an IEP or a 504 plan that involves transportation. All data on bus monitors staffing is tracked by the BPS Human Capital Management System. So that's basically their Office of Human Resources. They track the data as far as on-time performance, and they analyze the percentage of trips that have arrived on time using GPS data. So that is something that BPS has internal oversight of, and they report out to the public. As part of the BPS Systemic Improvement Plan, Ernst & Young has audited the BPS on-time performance calculation so that we can trust that it's accurate. And people may have questions about this, but I'll go through the rest of my report and then we'll take questions afterwards. So we can go to the next slide. You may also have heard that the MBTA is closing the Red Line for 2 weeks to make some upgrades. So the Red Line will be closed on the Ashmont branch from October 14th to October 29th, 16 days, and this will impact approximately 45,000 riders. The T will be focusing on track renewal, station repair, and slow zone reductions. During this time, the T will have shuttle services. They'll be producing a rider's guide, which will be published soon. All shuttle stops will be accessible, and a portion of the shuttle vehicles on the road will be low-floor buses. The T is also looking into the potential of adding accessible vans as well, like they did during the Orange Line shutdown last year. But as you can see, with the length of time, this shutdown will be a lot less of an impact lengthwise than the Orange Line shutdown was last year. So the city is collaborating closely with the T and all other city departments to mitigate the accessibility impact of the closure. Some sections of sidewalk will require patching and minor repair for accessibility. Our staff has already made a list of sidewalk locations, along with the preferred remedies to increase accessibility. And we've already seen Public Works getting on some of the locations we've identified making repair work. And we'll keep the disability community updated on any specific accessibility concerns related to the shutdown, either about sidewalk patching or the diversion in general. Next slide. Okay, just some updates on boards and commissions. I wanted to let you all know that we've heard directly from the mayor and from our cabinet chief what great work this board does. And Charlie, it was very interesting that you noted the priority of the board to keep work moving and not to just table things. So I think that this board does get a lot of work done, and your work is noticed by the administration and appreciated. So on that note, we do want to emphasize that disability representation is a key piece of the city's equity work, and we want to be sure that you're all putting your experience and expertise to good use. So if you'd like to learn about opportunities to serve on other boards or commissions, please let us know. It doesn't mean you have to give up your seat on this board, but the city has over 40 boards and commissions in all areas of local government, from housing to education to voting to development projects. So if you're interested in serving on another board, or potentially when you step off this board, if you'd like a new opportunity, please let us know. Because we know that all of these boards need a disability lens, and people with disabilities care about all issues, not just disability ones. And another thing about our local board, our particular board, I'd like to ask board members to think about your interest in returning to in-person meetings at some point, maybe next year. We can put this on the agenda for early 2024, although as I write this, I know that COVID is creeping back up, COVID numbers. So again, we'll see how it goes over the winter, and we can put it on an agenda in the spring. And of course, we'll be looking into the logistics of having fully hybrid meetings before we have this discussion, because we do definitely want to leave the online option open. We've always had it, but before it was more people could call in on the phone. But since COVID, we've really seen the benefit of having these interactive Zoom meetings. So we want to definitely look at keeping that in place, and then potentially having a hybrid situation where people could come in person if they were so interested. And that is my report. So I'm happy to take any questions if any board members have them.
This is Wes. I have a comment myself, but I'm going to hold that and let the board members speak first. I know that I see Richard has his hand up, so we'll have Richard. Go ahead, Richard.
Thanks, Wes. Commissioner, can you refresh me, please, what the role of the bus monitors is, and how many is a full complement?
Can we go back to this slide for a minute, Andrea? So bus monitors ride on the school buses. A lot of, I shouldn't say a lot, some special ed students have bus monitors as part of their IEP or 504 plan, which means that they are, the BPS is required to provide a bus monitor on the bus, either for the whole bus or particularly for individual students, if it's part of their plan. And BPS currently has 601 active monitors, and to be fully staffed up, actually, I don't know if I see that number in here.
This is Andrea. I was just checking.
Yep.
I don't believe we got that number from BPS. Not in the most recent update, so I'm trying to see if they sent us that number in a previous update.
Yeah, okay, that's a good call, Richard. I will have to get back to you if we don't have that information.
Thanks.
Can we close the PowerPoint again? This is Wes. It's easier for me to see folks when it's off. That's great, thank you. Okay, Charlie, I see your hand raised. Go ahead.
Thank you, Wes. Commissioner, thanks again for continuing to follow up with BPS and have that cadence of them reporting. And I did see that there's some additions of items that we've kind of been asking on, hey, how do we trust the data and all that? So we're seeing auditors come in. And I still think back to what is the premise of our questions in representing specifically that this commission can actually oversee or ask questions, et cetera, for transportation. So I know that we've been pushing on the helping hire monitors, just people to, with TransEv. So we open that up. There's the training. I know that you're working on the training and the maintenance and checking that out. But ultimately, a lot of the data that seems to be coming in is aggregated data in the sense of how are they doing on on-time percentages. But I think Olivia's on here, and she asked this question diligently one of the meetings back. Big question is, how many of these kids are getting on and why are they not getting on? But I don't know if that falls into our purview, right? If it's mechanical, 100%, right? And that's what we're doing with the controls on checking if people are trained, if the buses are actually working. But I think it ties into Richard's question too of the monitors. They're giving us an aggregate number, but we don't have the disaggregated number of how many of those monitors are one-to-one that are required for the student, right? And that are disabled or have a disability. And I think that is more of that I'm asking you to figure out as we figure out how we are proactively collaborating, but then also acting as a body to, as a pointed body of individuals to ask those questions of others, is that question of, great with the on-time percentage, but how many of those kids that we're asking about are actually on the bus to get to school? Because that's what ultimately that we're trying to achieve, right? Is understanding that and their access to being able to get to school. And the first part is that transportation, so.
Yeah, I think, this is the information that Dan reported to me. When I asked for an update, he voluntarily listed these items. But I can circle back with him and ask him if he does have data that's public on reasons for buses not being on time. Like you said, is it mechanical? Is it training? I know we had discussed that with him. I didn't ask him for those data points for this report, but I can ask him if he has those moving forward. And I think, you've asked a few times about what is the relationship between this board and BPS. And I think we can focus on ways that we can have an impact and things like mechanical buses and things like that, there probably isn't a lot we can do about that. But if it's issues of driver training and, interacting with students, I know there have been some instances where, it's been reported that a monitor is not available for a child one-on-one, but the parent says, oh, it's okay if they go without the monitor, but a monitor is willing to take a child who's supposed to have an individual monitor, but only has a general bus monitor, how are those interactions going? I could see us, potentially having some, interactions with that as far as what information Dan would have on that and what type of training monitors are getting, to ensure that all the children are safe and their needs are being met. Because Dan did emphasize the main thing that they are focusing on is every child's individual IEP 504 plan being met as far as transportation and monitoring. So like I said, the mechanical issues we may not be able to do much about, but the staffing and training of monitors would be something we could potentially, if not help directly, we could kind of, find out more information about what types of training monitors are receiving. So I can definitely, circle back with Dan and see if he has that information as public information and if he can share with us and in what ways we can work together moving forward.
Thank you.
Okay, this is Wes. Do we have any other questions or comments from the board members? Okay, I guess I can go ahead with my comment then. Commissioner, I know that you just talked about the possibility of having our meetings become hybrid or in person. And I've been thinking about that myself. I am involved on other boards and boards from different organizations. And I know that board meetings typically provide food. And I'm thinking that that may be some kind of an incentive to bring people into a physical space, to be willing to be either half in person or fully in person. I think providing food before the meeting offers folks an opportunity to socialize as well as be fed. And members of the public may also be more interested in joining us for these meetings if there's that social part as well as the meal beforehand. So that's just something I wanted to add to the voices in favor of the in-person meetings to provide some food.
Thanks, Wes. We will make note of that.
Okay, great. All right, looking further down on the agenda, or actually, do we have any other questions or comments for the commissioner about her report before we move on? Okay. Okay, further down our agenda, we have our architectural access report. Can we have Patricia, please?
Yes. Hi, everyone. My name is Patricia Mendez, and I'm the Director of Architectural Access. I'm going to talk a little bit about a follow-up from last month's conversation about the Boston Harbor Save the Day, Save the Bay, Save the Harbor conversation. So we have the information that they provided to us, and we have distributed by email to all of the members the information from them. But today I'm going to quickly summarize what the accessibility status is for these boats. So there's two kinds of boats. One is the official boats that go to the two main islands from the Boston Harbor, the Georges Island and Spectacle Island. So the official boats operated by the National Park Service and by DCR, they leave from the Long Wharf in Boston. And these leave from the Long Wharf Boston, and the pier is a flat, large wooden area, the ticket booth, and ramps down to the boats. The ramp is almost accessible, but it has a little bit of a lip that is like 1 inch tall. And then the issue with the ferries is that the levels are separated by staircases. So there's no elevator, vertical circulation from the levels. So there's not an easy way from user with disability to reach the upper levels of the boats. Next, please. Okay, so the other group of boats are the free cruises, the free boats to both Georges Island and Spectacle Island. So first I'm going to talk about the ones that go to Georges Island. The boarding is from Fan Pier, and the access ramp to the boat has a lip. Additionally, there are portable ramps that also have a lip, a gap that is significant. It's about 4 inches high. So that is challenging for people with disabilities. The staff of the boat is available to assist by lifting the person and helping them on the ramp. And again, there's stairs only between the first floor and the second floor and the roof deck. So no vertical circulation, no elevator. And also when you are in the boat and trying to get to the outside of the boat, there's a curb separating the outside level, the outside deck from the inside deck. So there's a curb, and there are some portable ramps that are helpful to mitigate that curb. When you get to Georges Island, the main pathways are accessible. So there is a restroom that's accessible, the picnic areas are accessible, and the water fountains are accessible. There are some potholes and some cracking in these accessible pathways. And in Georges Island, there's a fort, and the fort itself has 2 levels. There is only stairs connecting to the upper level of the fort, And in the first level, there is an accessible entrance, and there is a paved loop that goes around the interior of the fort. Next slide, please. Thank you. So on the Spectacle Island, there's a similar situation with the access. So all access, the free cruises to Spectacle Island, they leave from the seaport, from the Leader Bank Pavilion. The access to the pier is accessible. The ramp from the pier to the boat is usable, but it's kind of steep for someone that would use a manual wheelchair. This ramp takes people to the first level of the boat. The restrooms are on the upper level of the boat, and there's only stairs connecting the two levels. The ramp of the boat has a lip that is approximately 4 inches high. So it's pretty tricky. Okay, thank you. And once you get to Spectacle Island, there is a long, flat concrete area with shade that you can use for fishing and other activity. It's pretty large and comfortable and big. The pathways are not paved. The materials are dirt and gravel. And the swimming beach is rocky and does not have any mobility mats. There are 2 beach wheelchairs available. And there's a map, and there is a perimeter ADA trail around the perimeter of the island that is in good condition. There are some secondary trails that are less accessible because of some erosion and cracking and weathering. And there's one more. So the gist of this description of all of the boats is that the boats have multiple levels, and there's no vertical circulations, there's no elevators, it's just stairs. And then the issue that when you get in and out of the boat, it's kind of unpredictable whether you're going to need to board in one level and deboard on another level. And that depends on the tides. So some participants enter a boat on a different level than they will exit. This means that participants need to move between levels on the boat. And with that, I'll be happy to take questions.
This is Wes. Patricia, thank you so much for that input. I actually had a comment more than a question. It will lead to a question, if I can beg your indulgence. This past summer, I was on one of the ferries, on a cruise actually, in the North End. North End Against Drugs has an area, a local event every year, and that includes a cruise around the Boston Harbor. And I actually witnessed, unfortunately, an incident that happened on the boat when we were out. So the ramp that you just mentioned had that lip that you were talking about, that 4-inch lip. And apparently there was one person whose wheelchair was not able to get onto the boat because of that lip. It couldn't get it couldn't get onto the boat because it couldn't get over the lip. And there were people who were watching this whole thing happen, this person struggling to get over the lip onto the boat. And I don't know what kind of disability the person had, but the person tried to stand up and walk over the lip. And she wasn't able to get over the lip. She couldn't get onto the boat. And it was really surprising for me. And I wanted to ask you, Patricia, about why those 4-inch lips exist why the ramps aren't flat to begin with, but why, if there is a lip, why would it be so large? Because it really is hampering people's ability to enjoy themselves. It's certainly an accessibility issue. And so I wonder if we know why those 4-inch lips exist.
My guess is just lack of awareness, because there are products in the market that are much better than those. I think they just need to buy a new ramp that can be used and provide a shallower condition that doesn't have that 4-inch. That's pretty dramatic.
Sorry, Patricia, for the interpreter, provide a what condition?
More shallow.
That lip condition, that gap condition, it's like a vertical level change.
Thank you.
And an example is the kind of portable ramps that we used for the outdoor dining pilot in past year. It's basically a piece of metal that you can carry, a person can carry and deploy and put down. And it is designed for wheelchair users. My guess is that those ramps that right now are being used, they may be designed just for carrying things and stuff, supplies for the boat in and out, but they're not really intended or designed for wheels. That's my guess. So lack of awareness, basically.
This is Wes. Thank you for that answer. Jerry, I see your hand. Go ahead.
Thank you, Wesley, and thanks, Patricia. I've enjoyed going to the Harbor Islands for many, many years, and have found a day out at Spectacle and or George's Island to be very pleasant in the summer, and I was disappointed that I didn't make it out there this year. And I don't think I've made it out since the pandemic, but I look forward to taking advantage again. I wasn't here, I wasn't able to make July's meeting, so I don't know what prompted the accessibility report or and whatnot, but I'm a little bit confused because I know, Patricia, you've said that some of the ferries are available from Leader Bank Pavilion, and some of the ferries are available at other locations. That's not where I've boarded to go go to the islands before. So I didn't know whether this is something new or there are different companies that go out to the islands or not. Maybe I'm a bit confused, but I just checked too online, and the same company, Boston Harbor Cruises, says they did offer the same service this year, and all those boats depart from Long Wharf. So,
Patricia, do you want me to take this one since?
Sure.
Great. Thanks, Jerry. This is Andrea with the commission. So there are probably a dozen or more boat operators that operate in and around Boston Harbor. There is one that has a contract from DCR to run the, quote, official ferry out. So if you go to like the National Parks website and say, how do I get to the islands? It's a $20 ticket on Boston Harbor Now cruises. Right. Save the Harbor, Save the Bay is an organization that presented in July about a lot of their work that they do to make the harbor more what I call little a accessible to people in the community who may not know about all these resources. And so they, as a nonprofit, run a series of free cruises. Some are just cruises around, and some have a destination of Spectacle or George's. They're able to do that for free because at least 3 different cruise companies donate their boats to the program. And so the different cruise companies have permits to operate off different piers and different wharfs and different sections of the harbor. So that's why there are different places that Patricia mentioned.
Sure, yeah, that's what I thought. I just wanted to clarify that this Save the Harbor was a different organization that's able to offer different types of programming. But even on the official one, I find a lot of the access issues that Patricia mentioned as well. Although it's, like I said, it's very enjoyable, but there are challenges getting on and off the boat, but particularly, depending on the tide as well, whether it's high or low tide. So, thank you.
All right, Patricia, I'm not sure if you have any other comments.
No, I think.
This is Carl. I have a question for Patricia.
Okay, Carl, sure, go ahead.
So my question isn't to do with the presentation you just gave. I'm just wondering, last I heard, the Architectural Access Board, which oversees the variances that are submitted by developers and complaints that are submitted by people in the community, was not meeting because they didn't have enough people appointed to the board. Is that still the case?
Oh, hi, Carl. Thank you for your question. So the Architectural Access Board has been meeting regularly. There was one Monday that we didn't have quorum, but that was just one time. Actually, another time over the summer. So this summer, 2 times the meetings were canceled because of lack of quorum. Yeah.
This is Andrea. Carl, just to add, we heard from our intergovernmental relations team that the governor was finalizing appointments for the 3 empty seats. And I was told they were expecting those appointments to be finalized this week. And then, of course, those folks would need to be sworn in. But we just got that news like yesterday, so I hadn't had a chance to share it with you.
Okay, thank you.
All right.
Did I answer your question?
Yes, it does.
All right, this is Wes. Any other board members have questions or comments for Patricia? All right, thank you very much for your report, Patricia.
Thank you, Chair.
Okay, next on the agenda is announcements. Members of the board, anybody have any announcements to share?
This is Carl.
Hey, Carl, go ahead, Carl.
I just want to announce that back on July 26th, the 33rd anniversary of the ADA, that Governor Maura Healey signed a new executive order requiring that the state of Massachusetts and all the state agencies have digital accessibility as a priority, and is in the process of hiring a chief accessibility officer to oversee that. So we should start seeing some improvements as far as state websites, state electronic news, and things all digital, being more accessible to people of all abilities and backgrounds. So I'm very excited about that.
Yes, thank you, Carl, for noting that, sharing that announcement. Paul, I believe you have an announcement?
This is more of just a question that I have. I actually talked to Patricia about it in detail within the last few weeks. It's about the contractors that are digging up the sidewalks and roads and supposedly replacing them, but leaving them in awful conditions, whether it be concrete. No, it's not funny.
No, I'm laughing because I'm dealing with it in my neighborhood. I wasn't laughing because it's funny.
No, it's all over the city, and it's
Yeah.
ridiculous. So I'm wondering, maybe Richard, as an attorney, might be able to help with this. Maybe start to go after the contractors, not just call 311 and say, hey, they misplaced, the bricks, but this is really, walk by the State House, as you know, Carl. They've been working on that section of road now for over 2 years. They dig,
Yeah.
they redig. Now, who's accountable for this? Now, whether it be someone with mental, physical disabilities, blind, hearing, this affects everybody, and people without disabilities also. I'm wondering if there's just a way, maybe through the disability board, we can start focusing on these contractors, because they're supposed to be repairing things and they're leaving them worse than they were. And I've noticed people in motorized chairs trying to get up and down. Granted, the brick sidewalks are tough to begin with on Beacon Hill, or a concrete sidewalk in Dorchester the other day when I was there. And it's just the unevenness, the way they're put back together, just shoddy craftsmanship, and it's the contractor's faults. There are a lot of them I've noticed, like Affini Brothers, Maverick, Sharon, some of these, I just noticed the names on the back of the trucks. The same ones that are always there, and they're not just there for a few weeks, they're there for years at a time now. So I'm wondering if we can maybe draw a letter up to these contractors individually, get addresses, or somehow be part of the solution.
Wesley, I'd like to address this, please.
Yes, go ahead, Commissioner. Go ahead.
Okay, thank you. Thank you, Paul, for raising this issue. It is critically important. I will say that my office, particularly my architectural access staff, works on this daily. We're in regular communication with the Public Works Department. Contractors have to give a deposit when they work on sidewalks, and they don't get the deposit back until the sidewalks are put back into an accessible condition. There are all kinds of checks and balances through the Public Improvement Commission, through, like I said, our regular work, through complaints that we get. So we are on top of it. That being said, it is a very big responsibility. It's a big job because, like you said, it's a big city. We have over 1,600 miles of sidewalks in the city that get worked on every day, at least April through November. So I really appreciate your comments, and we take them seriously. I would not want to recommend going down a board where we bring in a lawyer at this point. I think that we can, circle back internally. In fact, we just had a meeting internally about this today, about conditions of sidewalks and how we can look at them systemically with Public Works to be sure that the big picture issues are addressed. Because not only the big picture issues, but the actual blocks that are in accessible conditions because of contractor work are addressed. So we are on top of it. That exact meeting came up today.
Okay, and they are being awarded more contracts in the way that if it was you or I, just being a common person doing something like that, we would probably be arrested.
Yep. But anyway, I would not recommend going the legal route at this point.
Okay.
We can talk offline.
Okay. I just wanted to bring up the point, and it's come to my attention from different folks that I've come across that have come to me for help, and I said I would bring it up at the meeting. Thank you.
I think a letter from the board, to the Public Works Commission or something, that could certainly be effective. But I'll leave that up to the chair.
I'm going to throw in on this one. This is Olivia. I got stuck in a particularly egregious tar patch a couple of days ago at the corner of Washington and Corey.
Yeah.
I messed up their tar patch. I don't care. My chair got physically stuck in it. I had to have someone pull me out. I feel Paul's anger on this.
This is Carl. Can I say?
I'm sorry, Olivia, when did that happen? This is Wes speaking. When did that happen?
2 days ago. I was crossing the street. The tar patch is actually in the street.
I'm sorry, when you said?
2 days ago.
2 days ago, 2 days ago, okay. Oh, wow. All right, Yeah, I'm being a little bit distracted by, I'm seeing something come up in the chat.
Balloons were distracting me.
Here we go, the comments.
This is Carl. Can I suggest that we discuss this at our next meeting as an agenda item and potentially write a letter to the Department of Public Works?
Okay, Carl, this is Wes again. We can put that under old business for our next meeting for discussion. And I just want to also respect everybody's time because we've only got a few more, less than 15 minutes to get through what we need to finish getting through. So I'm going to continue with the agenda of the meeting. So I'm just going to push on that. I see that Richard has a hand up. Is it an announcement? Because we're at announcements, Richard. Is that what this is about?
No, it's about the issue that's just raised. I just wanted to mention that the answer is probably in the contract with the contractors. So if we were to do a letter, it probably ought to be addressed to asking somebody to review the contract, make sure it has the appropriate language, and do something about it if there's something that can be done.
All right. Thank you for that comment, Richard. Going forward then, on our agenda, we have under old business, the statewide public space closed captioning bill. And I believe Carl has an update that he would like to share with us related to that bill. Carl?
Yeah, although it hasn't been publicly announced, I have it on authority that the two captioning bills, the one sponsored by Senator Barrett, Michael Barrett, and the one sponsored by Representative Denise Garlick, is going to be heard at the Children, Families, and Persons with Disabilities Committee meeting, and I believe the date is October 4th. Once the meeting notice goes public, I will send a link to Andrea to share with the committee so that people can register online to testify either remotely, in person, or they can submit testimony in writing and however they feel about this bill. But this bill is basically going to hopefully will replicate the success that Boston had with the captioning bill. We were basically trying to mirror what Boston did and hopefully make this statewide. So I'm on top of it, and as soon as the notice goes public, and it should go public fairly soon, within the next week, I will send that out to everybody, and I hope everybody will help spread the word so that we can get members of the community to support this bill.
All right, thank you very much, Carl. I do have a brief question for you. Will there be some kind of communication access for that October 4th event, testimony?
Yeah, I have already.
ASL interpreters, for example, for people to testify.
Yeah, I have already put in the request for all children, families, and persons with disability hearing for the year to have both captioning and ASL interpreters. So that should be all set.
All right, thank you very much, Carl. Next, I wanted to, moving on the agenda, I wanted to talk about, under new business, there's an item on our agenda. I'd like to talk a little bit about the impact of Laura's Law. All right, so some of you may or may not be aware of this new law, but it was something that I had actually just had to learn and absorb for myself recently because I have a personal story related to this. Previously, Governor Baker had signed into a new law, this law in January 2021, and now all hospitals in Massachusetts have until January 1st, 2024 to improve the lighting and the signage and the wayfinding and monitoring. They want to make sure that all patients who are in crisis are able to access the emergency room without any problems. This law was named in honor of a person named Laura Levis. And she had had a tragic death. This happened about 7 years ago. She was having difficulty, she was having an asthma attack, and she was outside of the Somerville Hospital, and she couldn't figure out how to get inside for life-saving help that she needed. And so the sad result of the tragedy was that she was only 30 feet away from the emergency room when the fire department responded to her frantic 911 call. Now, it's my understanding that some hospitals, including the Mass General Brigham, are currently updating the improvements. And unfortunately, that didn't happen in my case. So some of you may know that my wife and I are now blessed with a new child, a new baby girl that was born at Mass General Hospital about a month ago. And she unfortunately had to go back to the hospital. And she was in the pediatric ER. That was on her third night because she had extreme weight loss and she had what's called decreased output and jaundice. Everything's okay. She only had to stay overnight one night. And we ended up getting a modified feeding plan. And, right now she's a beautiful, thriving baby. She's got, plenty of milk, sleep, and she's got her diaper changes. But so the incident that happened was after I had dropped off my wife and the newborn at the ER, I went to park my car, and as I pulled the car in, I saw that there was what looked like a ramp next to the Lunder building, which is part of MGH, and so I thought it was an incline ramp, so I hurried to get over there to the ER after parking, but I ended up tripping over another path that really was a low step path. It looked like a ramp, and they were near each other, so it looked like it was part of the ramp. So I bruised my toe, and there was I was really disappointed because there was no obvious signage showing where to get to the ramp or warning that there was a step up, like caution, step up, between the stairs there. And it's a danger. And so I was told that this happens a lot in that area near the hospital. So I was doing some thinking about it. And I think the architectural design is just really poor. They need to sort of revisit many of their sort of areas like this. And I think there should be some sort of a warning sign that there are two paths there and they're right next to one another. So there's gotta be some signage. So I brought this up because I want to draw some attention to the fact that this obviously is related to signage and this Laura's law. So I want to just make sure that Mass General has confirmed that they would be, at least last month, was going to establish this walkthrough and have this, through a walkthrough, have a signage that would comply with Laura's law. And so, so I just wanted to make sure that we consider that. I want to make sure that we prevent this kind of an issue from happening again. And so my toe is slowly healing, right? I injured my toe, but I think that in the long run, I wanted to follow up. I need to follow up with my doctor on the toe, but this is something that I did want to talk about. I've been swimming laps, and so that helps my recovery, so it's relieving some of the pain for sure. But I do have two items that I wanted to bring up related to this, something that would really be like to open for discussion. And it's pertaining to access to the emergency room that could be challenging, especially for people who have— and I'd actually be interested in hearing any perspectives or concerns that you might have regarding this. And then the second item that I had is, how can we prevent this kind of architectural design issue from happening in public places all over Boston, outside of emergency rooms, for example? I mean, should there be some sort of indicating signage for something like this as well? So I'm curious. Thoughts? Okay, I see Olivia's hand. Go ahead, Olivia.
Yeah, it's funny you're talking about I know the architectural feature at Lunder that looks like a ramp but is actually stairs, because I've almost gone down it a few times myself. Yeah.
Yeah.
It's very confusing. I think architectural access board might be a way to get through on features like that, where it's so confusing.
Yeah, so I think, interesting. So if you know of anybody else who's had this experience with that area, I also will be open to hearing about their stories. I recognize, I think John Kelly has their hand. I'm sorry, Elizabeth, you have your hand raised first. Go ahead, Elizabeth.
Yes, this will be quick. First, congratulations on the birth of your daughter. But I'm very sorry to hear that story. But for that particular, for MGH, we happen to have the good fortune of having Zari as a board member. So she might have some helpful insights on ways to move forward for that particular setting. But obviously, there are issues throughout the city. And given the time in the meeting and that it is an important issue, could we perhaps table further discussion until next month's meeting for other stories about it? Other than, I mean, John had his hand raised already, but I think it does warrant further discussion, but that's my immediate recommendation about the MGH ones. Zari might already be aware of it. But
I think we would definitely like to have a continued discussion on this for the next meeting, so we'll do that. And again, I do want to respect people's time. Let's see, okay. Are there other questions or comments from board members? All right. Now, I think we need to open up for public input. So I'd like to recognize, we have one comment. We have a member from the public, John Kelly, who has their hand raised. So, John? Go ahead.
Thank you for unmuting me. I was disappointed that the commission did not plan to discuss assisted suicide at this meeting after having a tie vote in the July meeting. I think that there are real dangers to people with disability that need to be explored, and I would just say that the leading national disability organizations all support every national major national disability-led organization has taken a position against the legalization of assisted suicide because of the threat to people with disabilities. And those include insurance denial. That's how a couple of people died. Yeah, a couple, I don't remember their names right now. Oh, Bill Peace and Carrie Ann Lucas were each killed by United Healthcare by denying Carrie Ann the inhaler that she wasn't allergic to. She had to use the United Health cheaper alternative to save a few $1,000s, and she died a few months later. Bill Peace died of complications from bed sores because United Health would only pay for a bed, one of those sand beds while he was in septic shock. I'm sorry, not shock, but while he was septic. And then when he was stopped being septic, they took the bed away, and he didn't want any charity, and he died. And so this is a threat to people through misdiagnosis, mistaken prognosis. People lose months, years, or decades. Many disabled people themselves have experience with terminal diagnoses. And I'll leave it there, but I do hope that enough board members would like to have a discussion on this important topic at a future month's meeting. Thank you.
Thank you, John. I do recognize that you were not here. I believe that you were not here for the beginning part of the meeting when we did address this. I had shared some information about in my chair's report regarding this bill, and that we, the executive committee had made a decision that we were going to hold on discussion of this topic for the time being, because we're in the process of pursuing a more balanced set of information from different viewpoints. Of course, this is a controversial issue, and because it's so controversial, we need to have balanced viewpoints. So we're looking for people who are presenting, people who have information from maybe a different opinion, so that we can share balanced information to the members of the board. And so we do have this listed for ongoing discussion, and I do recognize that this bill is still, it's inactive currently in the State House. There hasn't been much movement on it, so there's plenty of time for us to continue to discuss it, but that's why it's not on the agenda for discussion this evening. And so I had mentioned this previously in the meeting in my chair's report, but I do appreciate your comment, and thank you for sharing your concerns. So now I'm going to ask if there's any other public input at this point in the agenda. I am not sure if I see, I don't see Carl. Is Carl still here? If Carl is not, does someone want to make a motion to close the meeting?
I move that we close the meeting.
I second. Elizabeth.
Okay, thank you, Richard and Elizabeth. Elizabeth for the second. We've had a motion to close the meeting. And so all in favor say aye, or raise your hand.
Aye.
Aye.
All right, everybody. The meeting then is now adjourned at 7:38. Thank you all. We'll see you at next.